Welcome back to the News at 9. Today we're here with Dr. Theodore Fellenbaum from Flint OBGYN. Thank you so much for joining us today.
It's my pleasure.
Wonderful. All right, so today we're talking about women's health and some non-surgical procedures that you offer to help women. So tell us a little bit about the EmSella treatment.
This is a brand new approach, but an approach that's been here for years. It just hasn't been elevated to the approach that it is now. It's called the EmSella chair, and the EmSella chair is simply that. It is a chair that you sit in completely clothed and undergo about a 30-minute treatment that is electromagnetic in its origin and is designed to stimulate the pelvic floor. And when we stimulate the pelvic floor, we actually increase its tension and the tissues around the pelvic floor, such as the urethra, the vagina, such that the incontinence, which plagues so many people in various ways, and helps them to correct this without surgical intervention. And I think that's the most important. This is something that is achievable without having to go through surgery. You can stop leaking when you laugh, you can stop leaking when you jump, and you can stop getting that urge sensation, and you can't stop the urine from occurring, or urination occurring at that point. This particular machine, I guess we call it the machine, is capable and FDA certified for the types of incontinence that we see frequently in our office. We see stress urinary incontinence, common. We see urge incontinence, and then we see mixed incontinence. All three are FDA approved for treatment by the EmSella chair. And it's a 30-minute session. You can bring a book and read it. It's not uncomfortable. It's sort of like a TENS unit, or a muscle stimulatory unit that we use frequently in treating other conditions.
So who would be a good candidate for something like this?
I think any woman who has, obviously, when we use electromagnetic force, any woman who does not have a metal appliance, like an IUD or something in there, is a fairly good candidate for this. We evaluate initially and see what kind of situation we got in terms of the type of incontinence. And then we begin our sessions fairly quickly thereafter.
So you mentioned sessions. How many are needed for this?
We do 6 sessions. We do 2 sessions, 30 minutes each, in a week, and then we do them for 3 weeks. So there are 6 sessions, very comfortable, 30 minutes, and sometimes it's hard to get people off.
Does someone have to be a patient at Flint OBGYN for this?
Not at all.
Okay.
We're open to seeing as many people in the community that have this particular problem, that would like to be helped by this. We're here for doing what we can do to make their lives better, drier, and happier.
All right. Well, thank you so much for being with us today and filling us in on this procedure.
Hey, my pleasure. We hope we get some people to come on in and try this. I think it would be an amazingly beneficial experience.
All right. And if you at home would like some more information about this, you can check out the hot links section on WNEM.com.